So this is a phase 3 trial of a modified RNA vaccine to prevent COVID-19. As the phase 3 trial, the primary endpoint of this study is trying to look at its effectiveness in preventing COVID-19. It's a randomized placebo-controlled trial, which means half of the participants will be getting a dummy vaccine while half will get the real vaccine, and the plan is to follow them up for 2 years. So this is a truly multinational study. There are sites in South America, Brazil, and Argentina. There are also multiple sites in the United States. So for COVID-19, we do know, at least in the United States, that ethnic and racial minorities bear disproportionate impact. So infection rates, hospitalization rates, and deaths definitely occur more frequently, particularly in Blacks or African Americans, Latinx individuals, and even in Asian Americans as well. So it is critically important to have diversity in enrollment, and so that way the results are generalizable to the individuals who are at highest risk for the disease. We've had strong support from Yale University through a Cultural Ambassadors program supported by the Yale Center for Clinical Investigation that has really developed long-term relationships with communities of color through community leaders, churches, community-based organizations, and have really developed these relationships over time.
So many people have died, so many people have gotten sick. The cultural ambassadors wanted to make sure that people were informed about the vaccine. Number one, there's one word: fear. You go back to the history of the Tuskegee situation, that people are still wondering about that today. So those are some of the reasons why people are a little slow or reluctant to move forward in this area. Looking over the past 10 years or so, we've noticed that we went from probably 6% of minority participation to 30, 40, 50, and probably in some studies 80%.
One thing that is really the currency for enrolling ethnic and racial minorities in clinical trials is trust. Trust is really important, and this is not usually established in the short term. This is established over long-term relationships. And so the Cultural Ambassadors program has achieved that elusive goal of establishing that trust and credibility and really long-term relationship that has fostered the opportunities and participation in clinical trials. Everyone's kind of come together in this era to address the plague of our time and try to fast forward and fast track what could be a game changer, which would be an effective vaccine for COVID-19.